Hello, welcome to the clinic. So, the doctor sent me to you because I should do a full body examination, or just like a full examination. A lot of these things we're gonna do is actually the same thing you do at a cranial nerve exam, but I just want to make some notes here first, just to make sure you are the correct patient. So, your full name? Date of birth? Okay. And may I ask, do you have any allergies or something like that? Also, just so we know we have noted the correct things. Okay. Are you on any types of medicines right now? Are you taking anything right now? Yeah, that's also quite important, and sometimes you just don't think it's anything particularly important things to actually mention to your doctor, but then you come in here and then you just think about it anyway, so we actually always ask that question twice. Yeah, so both the doctor and here the nurse. Okay. So, can you explain what symptoms are you experiencing? I know you talked to the doctor as well, but now it can vary a little bit, and then I can get a new perspective on the problem as well. So if you just explain shortly, what are you experiencing? Continue. Okay, now it's saved. Okay, so I think that some of the things we're gonna do at the beginning is just if I can just listen to your heartbeat. I do not have to take your pulse today, I just need to listen to your heartbeat. So I will just come under your shirt here. Deep breath in and out. Deep breath in and out. Yeah, you're doing great. You're doing great. Just again. I know it's a little bit cold, isn't it? Yeah, it is a little bit cold. And I will just put on my gloves. I just forgot that. Sorry about that. Okay, so now we listen from the front. If you just turn to your back, then I will listen again. And that will also be a little bit cold, so sorry about that. And you know what to do. Yeah, okay, good, very good. And I will just take a few listens again. So now we're done with that part, and there was nothing to worry about. It's totally normal, so I just wanted to say that to you. So if you just want to take your shirt completely off, then I do have this device right here, where we're gonna measure some general fat percentage, capabilities, you know, like we do have a DEXA scanner, but it's quite expensive to use for a normal full body checkup. So here we are just relying on this for now. If we see anything, then of course we'll get to the DEXA scanner, which is more accurate. But this one will do a great job for now. And I will just take like 4, 5, 6 measurements, and then I will just see if the chart matches up with my results. So I have to actually pinch down in the skin, and it can be a little bit uncomfortable, but it shouldn't be that bad actually. So yeah, I will just take some skin right here at the stomach, just like this, you know. Yeah, and just pinch down on the skin. Yeah, just pinch down on the skin. So I'll just do it down here. Pinch. And I need to write all the measurements down. And down the side of the stomach actually. And now I just want to do it on the back. So if you just turn around. And also on the thighs. So if you just take your pants down, then I will just do this on the thighs as well. Okay. And now we just can calculate the total measurement. I will just do that right here. Okay. Yeah. So it seems like you are in quite a good spot with the fat percentages in your age group. So that's great. Yeah, that's a quite healthy level. You do not want to be too low, because then just this system does not work properly as it should, and do not want it to be too high, because there's a lot of lifestyle diseases that you can catch, just like diabetes and stuff like that, and your immune system will not be as strong as it could be and stuff like that. Especially if it's like autoimmune diseases and something in that regard. So you are in a perfectly healthy and nice fat percentage with this general skin fold method. So that's nice. Then we don't have to worry about that. With that said, I just want to measure around the stomach, because we also need a general measurement there for the next checkup. It doesn't only have just to be fat or anything like that, but if you do have something with the organs, as well. Then it can also expand the stomach, so we also want a measurement on the stomach now. It doesn't just have to be fat because your fat percentage is quite nice. But if you do have anything with the organs, the intestines, and stuff like that, some digestive issues, then we also need a little bit of a measurement here at the stomach. Is that okay? So we just stand completely normal as you normally would. Then I will just take this clip in here. Okay. That is great as well. But we need to have it as a measurement for the next time, at the next checkup, just to see. Now we need to test the hearing, actually. I have this device. I will just tap it on it. Then you will hear something like this. Can you hear that? Great. So now I will just tap this. Is that clearly? Tell me when it stops. Good. How about now? Tell me when it stops. Great. I will do this some from ear to ear, and also just if you just close your eyes, then I will go from one ear to the other ear, and then you have to tell me which ear it is. Yeah. That is great. That's great. Now, with the same device, I have this edge right here. When I just do like this, then it will vibrate. Then I just hold it here, put it on here, and then you should also just tell me when the vibration stops, and if you can feel it. Can you feel it? Great. Very good. I just almost at the clavicle bone. Now we'll just use it on the different side of the trapezius. And the other side. Great. I really like that sound. I don't know. I hope it doesn't make me wrong, professional, saying that. Now I want to test your smell. Quickly, like some different smells here. I do have some different containers with some liquid in it. It is a strong, powerful smell on each by something you should be able to recognize. So now I'll just be testing that. Here is the first sample. Just rimming down the nose here. What does that smell? Yeah, peppermint. That's correct. Very good. The next container. Orange. Yeah, also correct. Also correct. The next container. That is correct. Right monster. Yeah, that's correct. Yeah. That is a smell everyone should know. That is totally true. And now here. Yeah, cherry. True. That's also correct. Let's take the next smell. This can be a little bit more tricky because it's a little bit more niche, but let's see. Yeah, it's like sandalwood, like burnt wood, so yeah, you're correct with that one as well. Now for the final test, actually, I have this right here. It is just like if I tap on some certain places, will you react? So yeah, it's just like a reflex test compared with some other tests as well, because I will just see if you can feel light taps, but also some reflexes. I will tell you when I do whatever. So now I'll just test a reflex on your arm. So if I just do a light tap. So that's great. The other arm, light tap. And the jaw. It's a very, very, very light tap, so don't worry. And the side. Yeah. Now we'll just do it on the hand. And the other hand. Great. I do not need to check the knees this time. I don't have to do that. I totally forgot. We needed one more test actually. I have this gua sha tool right here. I do not use it for gua sha myself. I use it to scrape a little bit on the skin, see if there's a quick rush of blood to the surface of the skin, just to see if your histamine response is totally healthy. So that is why I do this. It is also a very great way to see if there's anything with your immune system or something like that. So I will just take your trapezius muscle here, just to scrape a little bit, see how fast your histamine responds. And that's great on that side. Now this side, right here, I will just test it. That's great as well. So now I just checked that half. I also need to check a little bit lower just to see if the lymphatic system is how it should be, transporting lymph fluid and some stuff like that. So I will just check here down. That's great. That's great as well. And just on the chest as well. That looks great as well. So as far as I can see, in this examination right here, it doesn't seem like there's a problem. I think the things you're experiencing can be stress related. It can be something in your everyday life, so we have to check on that. But right now, in your full body examination right here, it should be totally fine. It looks totally fine. I will of course consult with the doctor. I do have permission to also give a diagnosis if I do have one myself, to give you, but right now there's nothing that I can give you as of right now. But I will just write this down. So, is it okay if I ask you, have this been a good experience? Have you felt safe? Have you felt relaxed or anything like that? I want to know from the patients themselves how the experience was, because then I can take it to myself and use on the next patient, if it doesn't feel safe or something like that. Okay, it was a great experience. I'm glad. Okay, is there anything I could have done so you would have felt safer, so you would have felt more relaxed or anything like that? Okay, the tempo was nice, and the calm voice was also quite nice. I'm very happy that you say that, because it's something that I try to do. Just take it a little bit slower, just like take my time on each patient, and just try to be very calm and have a relaxing setting, with the lights in the background and just LED lights, so don't worry about it burning stuff down, it won't. But I'm happy to hear that you enjoyed it, and it was a nice, safe and calm environment. So I will consult the doctor on my findings, on my information right here, and then I will of course get back to you. You can just check it online. We will send you a message, and then you can check it online. Yeah, that's how today's age is, We'll just send things online now, but I hope that's okay. I hope that you will get a great day, the rest of the day.